physios, I welcome you all to our channel Physio Vidyapit. We are back with our next lecture on cryotherapy or the cold therapy. Okay, so now we are studying about contraindications and precautions of cryotherapy. It will be a small lecture and easy to understand. Okay, so as you all know, my name is Vijay Kumar and let's get started. The first contraindication is peripheral vascular disease. Okay, so for example, the individual is suffering from arteriosclerosis. So this is the normal vessel, but in arteriosclerosis, which is a age-related degenerative change, it caused the thickening of the walls of the blood vessel. And if you can see that if there is thickening of wall, then the lumen is reduced, that is the blood flow will be reduced. And if we will apply cold pack here, and it will definitely cause the vasoconstriction, the blood flow will be further reduced. Initially the blood flow was already reduced due to arteriosclerosis, and if we are applying cold pack, it will further reduce the blood flow and cause a detrimental effect. Okay, so it will produce a complication. So we will not be using the cryotherapy in peripheral vascular disease. What is this? This is arteriosclerosis. Okay, simple. Next is vasospastic disorder. So it is related to the again related to the vessels. So here vasospasm occur. For example, Raynaud disease. In some books it is written as Raynaud syndrome. Mostly it affects the hands. Okay, so this is the hand. Okay, so this is the normal blood vessel here. Okay, which is supplying. Okay, so if there occur a vasospasm, that is the vessels, that is the minute vessels of the hand become spasmodic, that is the lumen will be reduced. So it will be like this, it will be like this, that is a narrow lumen. You can see the change from here to here. So here also the reason is same, that initially also the vasospasm is occurring, and if we are again applying the cold, there will be vasoconstriction. So further blood flow will be reduced to the hand, that is most commonly in the fingers. Okay, so there can be cyanosis also, and you might have studied about this particular disorder. Okay, so one more thing which is a good explanation of this thing is that many of the studies explain that this Raynaud disease occur due to cold exposure. That is, whenever we are applying cold, there occur vasospasm. Okay, this is the Raynaud disease. Okay, simple. So initially also there is vasospasm, and if we will again apply cold, further vasoconstriction will occur, reduction in the blood supply will occur, cause cyanosis and other complications. Next is cold urticaria. So it is also called as the hives on skin. That is, in some individuals, when we will be applying cold pack, within 4 to 5 minutes there will be irregular bumps which are produced on the skin, which are called hives, and these hives can be limited to the area where cold pack was applied and can spread to the nearby areas. Okay, so I am adding picture for you also. So this is about cold urticaria. So the problem is that how we can detect the cold urticaria. So whenever we are going to add cold pack in the treatment of any individual, you need to first apply it for 3 to 4 minutes and check the response. And if there is itching, okay, and along with the hives on skin, so it means the person is having cold urticaria, so we will not apply cold pack in this condition. Next is cryoglobulinemia. In this condition, the patient is having abnormal protein which is called cryoglobulin. What is the name? It is cryoglobulin, and it is a temperature sensitive protein. That is, when temperature is reduced, this protein will precipitate and may cause obstruction, and if obstruction occur in the blood vessel, blood supply will reduce, again may cause ischemia. Okay, so here also we can detect it by the blood test, that is presence of cryoglobulin. Okay, and if the temperature is high, that is the normal temperature 37 degrees Celsius, this protein dissociates and produce no problem. Okay, so it is normal at the normal body temperature, but when temperature is lowered, it gets precipitated and produce a lot of problems. So we will not use cryotherapy here. Last is over regenerating peripheral nerves. If the injury to the individual has also produced the injury of the nerves, okay, and the nerves are regenerating at that part, so we will avoid the application of cold pack. Why? Because the regeneration process, that is the regeneration of nerve, is reduced by the application of cold pack, so it is having a detrimental effect on the regeneration of nerve. So definitely we will not be using cold pack in regenerating peripheral nerves. So peripheral vascular disease may further reduce blood supply. Here also same thing. Cold urticaria, hives and itching sensation. Test by 3 to 5 minute cold application. And here we are using blood test, and which is having a cryoglobulin inside it. Next is over regenerating nerves. This is about the contraindication. Next is the precaution. First is open wound. If the open wound is superficial, for example, you receive the cut on the skin, you go and put your finger under the cold water tap, that is good. But if the wound is very deep, then we will not apply the cold pack directly, because it will slow the metabolism and further reduce or slow the effect of healing. Okay, so we will not be using there. And in case of superficial wounds such as pressure sores, there also we do not apply direct icing, we will apply it at the boundaries. For example, this is the body part which is having pressure sores, we will apply the cold pack at the edges, that is at the surrounding of the pressure source with the precaution. Okay, then is hypertensive patient. It is very simple to explain. So BP is already increasing, and if we will apply cold pack, it will further cause vasoconstriction, further increase the BP, so it can be a problematic cause. So if the blood pressure is increasing beyond the normal limits, that is toward a very high BP, so we will avoid the use of cold pack. Okay, and if it is increasing in limits, then we can apply. So you need to check the response of the cold pack on BP. You will apply cold pack and check BP, that whether it is increasing to a slight milder level or to a higher level, because there might be some condition that patient is hypertensive, also having vascular disease, that is BP is already high, vessel is already reduced in the lumen, and if we will apply cold pack, further reduction in lumen will occur, hypertensive crisis will occur, that is BP will be tremendously increasing. Next is cardiac disease. So if any patient is suffering from the cardiac disease, for example myocardial infarction, so in myocardial infarction the blood supply to the heart itself is reducing. Okay, and if in that patient in which the blood supply to heart is reduced, ओके क्या हुआ है, हार्ट की खुद की ब्लड सप्लाई ही खराब है. ओके, और हमने क्या किया, उस पेशेंट को कोल्ड पैक लगाया. कोल्ड पैक लगाने से क्या हुआ, वेजो कॉन्स्ट्रिक्शन हुआ, और वेजो कॉन्स्ट्रिक्शन हुआ तब क्या हुआ, हार्ट के ऊपर वर्कलोड बनेगा, वर्कलोड और बढ़ जाएगा, विच विल फर्दर क्रिएट प्रॉब्लम। क्यों? क्योंकि हार्ट की खुद की ब्लड सप्लाई ही कम है, दैट इज द इनपुट इज रिड्यूस्ड। सो आउटपुट को हम कैसे बढ़ाएं? आउटपुट क्या था? वेजोकंस्ट्रिक्शन जो हुई है, फिर भी ब्लड फ्लो को मेंटेन करना, इट विल बी वेरी डिफिकल्ट। ऑल्सो वी विल अप्लाई द कोल्ड पैक ऑन द लेफ्ट शोल्डर विद द प्रिकॉशन। क्यों? क्योंकि हार्ट और लेफ्ट शोल्डर दोनों की जो पैरासिम्पैथेटिक सप्लाई है वो है कॉमन, दैट इज बाय द वेगस नर्व, एंड इफ वी विल अप्लाई द कोल्ड पैक that will stimulate the parasympathetic supply, that is it will stimulate the vagus nerve, which will cause a negative effect on heart, that is heart rate will be reduced, that is negative effect on heart. Okay, सो अगर इंडिविजुअल को पहले ही कार्डियक डिसीज है और हमने हार्ट के ऊपर जो उसका कंडक्शन है वो और स्लो कर दिया है कोल्ड पैक लगाकर, सो डेफिनेटली इट विल बी अ problematic situation. Next is defective skin sensation. You can compare this thing. There is a normal individual, there is an individual with lack of sensation, and if we are applying cold pack, what is going to happen? Okay, so the patient will say that initially I am feeling numbness, and then there will be a mild, then there will be a analgesia. Okay, that is the person is able to explain that what he or she is feeling on the application of cold pack, and at the end, that is after 10 minutes, he will say that yes, now I have analgesia on my skin. But in some patients who have reduced skin sensation, they cannot explain these things. Okay, so there can be a cold burn, so we should have a precaution in application. Next is skin hypersensitivity. So in some patients when we apply cold, it produces numbness, color changes, and excessive pain also. Okay, so here also we need to have a precaution. Last is adverse psychological factors. Okay, so in some patients with mental impairment, they have a aversion toward cold, that is वो cold से एक तरीके से there is a fear toward cold, so here also we need to have a precaution in the treatment while using cold packs. Okay, so this is about the contraindication and precaution. एक बार फिर से रिवाइज करते हैं. पेरिफेरल वेस्कुलर डिसीज सच एज आर्टेरियोस्क्लेरोसिस, ल्यूमन पहले ही कम है, कोल्ड पैक लगा के और वेजोकंस्ट्रिक्शन, तो सप्लाई कैसे होगी? सो इट मे कॉज एस्टीमिया. सिमिलरली इन रेनॉल्ड डिसीज, कोल्ड यूटिकारिया में क्या करना है? क्या होगा? हाइव्स ऑन स्किन विद इचिंग. ओके, सो टेस्ट क्या है? 3 से 5 मिनट लगाओ और पहले चेक कर लो, और अगर हाइव्स एंड बर्निंग सेंसेशन अलोंग विद इचिंग इज प्रोड्यूस, सो द कोल्ड पैक इज कॉन्ट्राइंडिकेटेड. क्रायोग्लोबुलिनीमिया में भी हमने क्या करना है? क्रायोग्लोबुलिन चेक करना है, जिससे अगर वो है तो वो प्रेसिपिटेट होकर ऑब्स्ट्रक्शन ना कर दे. रीजनरेटिंग नर्व को वो रिड्यूस करता है, सो हम अवॉइड करेंगे. एंड दीज आर द प्रिकॉशंस. ओपन माउथ के साइड साइड में लगा सकते हैं. हाइपरटेंसिव में चेक करना पड़ेगा बीपी कि अगर एक्सेसिव इंक्रीज हो रहा है ब्लड प्रेशर में, सो वी विल अवॉइड इट. कार्डियक डिसीज में लेफ्ट शोल्डर पर लगाना अवॉइड करना है. ओके, देन डिफेक्टिव स्किन सेंसेशन में भी आई हैव ऑलरेडी एक्सप्लेन. लास्ट इज हाइपर सेंसिटिविटी एंड abnormal psychological factors. Okay, so this is about the contraindications and precautions. In our next lecture we will study about methods of treatment or method of applications. So till then you keep on studying. Thank you to one and all.